Hey, good morning, everyone. We got a really cool topic that we want to discuss. We were just discussing it before we pushed the record button. I told Teresa, hey, we need to get this on camera so that people can have a better understanding and use
Yeah.
their own, I guess, informed process of whether or not we should be taking fish oil. So recently, the way this conversation was started up and we were talking about here just shortly is that the British Medical Journal, a very prestigious journal, had recently published an article about safety concerns of fish oil consumption. So if you're out there and you've been hearing take fish oil for better brain health or for heart health or for better joints, what else do people take fish oil for?
Those are the two things, brain health and heart health. Heart health is like the big thing. So if the BMJ is saying, oh, don't take it because there's now heart risk, people are going, what? What? Where did that come from? I thought I was supposed to be taking this for my heart. Now you're
Mhm.
going to tell me it's going to mess up my heart? What in the world?
Yeah, and it was a recent study that they published, and it's the regular use of fish oil supplements in course of cardiovascular diseases, a prospective cohort study. So first of all, people probably don't understand research papers out there. So just briefly give a background of maybe if a person comes across an article, what do they want to pay attention to, or what do you think they need to look out for?
100%.
Couple of quick
The one
tips.
that comes to mind, the most controversial thing that comes to mind was the study that was published about hormone replacement therapy and the risk of breast cancer. And that was totally misconstrued. The data was misconstrued, and then the representation of the data was misconstrued. So the general person, and I was one of them, like before I went through school and everything and learned how to read research, I was like, oh, I'm not going to do hormone replacement. And then when you go in and you look at the article and you're like, well, they didn't do the data right. And they misrepresented what they said. So what you want to look at, the very first thing I always do is read the abstract. What was this test done for? What was the objective? Did they reach the objective? What were their conclusions? So I get an idea of what it's about. And then I go through the article myself and I look at, you know, what did they pull out? A lot of times they're not supposed to be biased, but a lot of times they are. So if they are setting out to find one thing and they're trying to prove one thing, that's usually the one thing that they're going to bring out, but they might neglect to say, or it's like in the small print that there was other things. Like this particular article said, well, taking fish oil increases your risk for this irregular heart rhythm, and that it's called atrial fibrillation, which is like the top chamber of the heart quivers a little bit. The electrical current goes around and around the top chamber. And so taking fish oil, they said, does have an increased risk, except that it's just because it's an observation doesn't establish causality, meaning that there's not a cause A causes response B. And we also have to have a healthy lifestyle. There's a lot of other things that increase our risk for that. And there's all kinds of good things about fish oil and what it does given the right kind of fish oil. So that's where I'm coming at fish oil. Just a general discussion about fish oil is just my number one concern is sourcing, because a fish is not a fish is not a fish, right? It's what are they eating? What are they allowed to swim freely? How polluted is the water that they swim in? Are they able to eat whatever they want? Once they harvest the fish oil, is it being tested? That kind of thing. So the quality of it. And also, we'll have this part of the discussion is the fact that the fish don't innately have the oil. They get the oil from the things that they eat. And so if you're concerned about the fish oil, you can actually take what capsules of what they eat and get. So anyway, in reading an article, you have to really look at what was the objective? Was it represented well? What were the conclusions that they draw? Did they show like a cause and effect? Was it significant? How much of it's called the P factor. How many people participated? That's the N and the number of participants. How much is a P? How the P factor is like the certainty. How certain are they that this is true data? And does it show causality? And what dose? Did they actually have a dose? So they didn't actually put a whole lot of details about the dose in this article. So that really makes a difference too. Are they taking just a little bit? Are they taking like bucket loads? Like how much? So, and the article also didn't tell like what forms are they taking, because not all omega-3 supplements are the same. You can get different fatty acids from the fish oil. So, and they affect us differently. The different types of omega-3 fatty acids affect people differently and work differently in the body. So that's really, when you're looking at an article, the things you have to look at, just make sure that's a really good sound article and that it really represents the truth of the art of the study.
I would also mention in there the conflict of interest, because a lot of times people can be funded by pharmaceutical industries
All
that
the
want
time.
for a hidden purpose or known agenda. So these guys are being funded with a lot of money to say what the pharmaceutical industry wants to be said,
All the
regardless
time.
of outcome. And so,
Pharmaceutical companies fund research all the time, or medical device companies fund research all the time. So if you don't have if you're not a third party looking in from the outside, that's a big check for me. Like thank you for bringing that up, because that's another thing that I would look, who's funding this? What's the purpose of it? What are they trying to do here? Because I worked in a hospital, in a teaching hospital, and I worked in the cardiac catheterization, like the invasive cardiology. And we did research all the time. We did research on medications. We did research on devices, and they're all the time sponsored by the company like making it. So they want their thing to be good, right? So that's a big thing for me. There's a lack of neutrality when you're the one putting all the money into this study.
absolutely. And that's one thing that you can always go look at right at the very top. Whenever you go to Google Scholar or PubMed and you search in your topic, you can look at the conflict of interest in the authors to see if they declare that, hey, we were funded by such and such group.
Right.
And that might have an influence on the way they present their data. I always read the abstract, then I always go to the conclusion, and then I always look at the conflict of interest to see. And that's like my first protocol. So back to fish oil. So fish oil, this whole premise that first they're looking at individuals who had no pre-existing cardiovascular issues, and they're looking at, does fish oil consumption increase the risk of one developing atrial fibrillation? Again, that's heart palpitations, a heart out of sync, out of rhythm. You hear people say that I have a flutter, or it feels like my heart's going these weird kind of beats that are out of balance. And it can be super rapid. My wife, when she was younger, had an ablation, which is a treatment most often to correct atrial fibrillation. Hers was supraventricular tachycardia, which is a type of fibrillation. It's a very rapid heartbeat, almost 200 beats per minute, where you want to pass out.
All the places in the heart that aren't supposed to be firing the electrical current. So our heart is supposed to top bottom. And that only happens because of the way the electrical current goes down through. Atrial fibrillation is there's excitable spots throughout the heart. It is one type of supraventricular tachycardia. So on a piece of paper, when you look at a 12 lead, it looks like a wavy baseline. And then every once in a while, you'll have a regular ventricular beat. It's different than atrial flutter, which has a sawtooth baseline. The atrial firing is pretty regular. It's just not synced up with the ventricle. And the SVT, the supraventricular, like your wife had, is really like a paroxysmal, where it's just going fast. The whole thing is going through the right pathway, but it's just way too fast. And so the biggest thing that they do is medication to slow things down, prevent clots, and then go in and cauterize the excitable areas so that it fires the way it's supposed to and only goes down the path that it's supposed to.
Now, really think about this, because a lot of people have nutritional deficiencies. They have a lot of toxicities. So if my wife and her parents at the time would have known this back when she was 14, 15, they probably could have corrected.
Yeah, no. So the looking now with the knowledge that I have now, however, it's not sustainable for someone's heart to beat that fast. They do pass out, and they get really fatigued really easily because their body cannot think about it. If the object of the heart is to squeeze blood, which carries oxygen throughout the body, if it's beating so fast, the amount that it's able to squirt out in all those little tiny pumps is not a lot. So a lot of oxygen does not get to the brain. That's why people pass out. It doesn't get to the feet and the hands, which are the furthest thing away from the heart. So it really is not conducive to having somebody stay in that for a real long time. And there's things that we can do. We have people like bear down like they're going to go to the bathroom, or we have them blow through a straw, which stimulates the vagus nerve, which slows down the heart. And sometimes you can break it that way. But the big thing is or we can give them medication to slow down their heart rate. But like the big thing is, why is it doing that? That's like the big thing. So figuring out the why, and heavy metals are a big
All right,
factor.
yeah.
Heavy metals are really neurotoxic, and mold too. Very hard on the brain. So the brain doesn't work the right way. It's what stimulates and creates all the nervous pathways, the nervous system pathways through the body, including, and then nutritional deficiencies, electrolytes imbalances, things like that, because that's all needed for the pump, that the transfer of things in and out of the cell to make the electrical current be the way that it is. So if I had a patient who came to me with this going on today, we would do two things. We would do what they needed to do to slow down their heart, and then figure out what's making their heart be that way. And then if it was going to take a while for it to resolve whatever the underlying cause is there a need for an ablation? I think it depends on the person and how sick they are. There's a time and a place for everything. And sometimes this is where Western medicine really shines. If someone has a hole in the septum in their heart, or atrial fibrillation, their risk for stroke because they throw a clot to their brain is pretty high.
Yeah.
And you don't want that. You don't want them to die or have a
Right.
life-changing event. That's the reason why we do those interventions. So, but then do we fix the underlying cause? Yeah, we do. Sometimes it's a birth defect. Like sometimes that's all it is, and you can't change that. It's a birth defect in the heart. So anyway, that's part of the whole mechanism behind atrial fibrillation. And the other thing about the fatty acids, some of these fatty acids, the EPA, and the DHA they're good for preventing stroke. Our cell membranes are made of fatty acids. The function of every cell in the body, it has a membrane it's called a phospholipid bilayer. And so it's like I think it looks like a jellyfish. It has a head and then 2 feet, and then they touch, the feet of the jellyfish touch. And those are good fatty acids. But if we take in bad fatty acids, this is the whole omega-6, like people really think the omega-6 fatty acids are bad. Well, no, they're not. The wrong kinds are bad. They displace the good ones. So we need to stop eating fried foods and seed oils that can get rancid and get stuck in our cell membrane, take 2 years to get out. We need to stop that. And then we need to replace the good fatty acids with a 4-to-1, 6-to-3. So it's supposed to have four times as much omega-6 as we do omega-3 in that ratio. And that will help to replace the bad fatty acids to get our cell membranes working, because it's the brain of the body. It's what tells us to do. It's what tells the cell to do everything that's supposed to do, including receive nutrients and hormones and produce energy, open up the detox pathways, turn good genes on, turn bad genes off, things like that. So like the fatty acids themselves really need to be the right kind in the right ratio. And so they're not all created equal. And the fish, like I said earlier, I alluded to earlier, they don't innately have these fatty acids. They produce them because they eat algae, and that's what contains the fatty acids. So if you're really worried about taking the omega-6 and the omega-3 fatty acids, eat the algae, have the supplements that are algae supplements, or make sure that you're getting fish that is allowed to swim freely, that has good diet, that doesn't live in polluted waters, and that the supplement itself is being tested before it's being released in production, so that you're getting a high quality product.
I agree 100%. You had a lot of great things to say there. There are things that we can do beforehand, because most cardiologists, they don't explain why people do have AFib, and they just head straight to the prescription pad or to set up that ablation, because that's just what they're trained to do. Sure, they'll examine you and they'll set up like an ECG or something, and an echocardiogram, and then that's just their standard of practice, I would assume. You would probably know better than I would, but
the standard is to try the medication and the other mechanisms first. But then if those don't work, and depending on the risk, if the person has already had a stroke, or if they've already had other cardiac risk factors, then they might lean to the procedure sooner rather than later. It depends on, everybody's different.
And from just standard responses that I think most people probably hear from a cardiologist of why do I have atrial fibrillation, or what's the cause of it? You're getting older, high blood pressure, abnormal heart valves, or maybe sleep apnea could be one that they throw in there. We don't know is a probably very common one. And they use calcium channel blockers, they use beta blockers. Metoprolol is a very popular one that I recall.
That's a beta blocker. It slows the heart rate down. It affects the vagus nerve and it slows the heart rate down.
And so we do know that chemicals, nutrition status, you mentioned heavy metals, cadmium, lead, mercury, three big common ones that are probably in almost everybody, if not in everybody, including myself and you, just because of our environment that we live in today with everything out there. But you got to think about your workplace. What are you exposed to on a daily basis, especially if you are working in an industrial format where you might be exposed to some things. We know that pesticides can be linked to cardiovascular diseases and cancer.
Yeah.
What are some natural things that people can do? And I know we talk about the journal and the article from the BMJ about fish oil supplementation and their scope on this, but what are some other things that people can do that would maybe support natural heart rhythm or reduce their risk for cardiovascular outcomes?
Yeah, no, I think one of the things that is easier to do now than it used to be, and that is just to test what your nutrient levels are, see what you need, see where you're getting. So testing for sure. The one supplement company that we like, they make exactly four supplements and they have a test. So this is what they're really good at. There's another company that actually there's a couple companies that have really good fatty acid tests. The one is they started as just a heart lab kind of lab company. They just focus on cardiovascular lab testing. So that's one thing you can do. Another thing is stop eating fried food. Stop eating seed oils. Stop eating anything. Since I started working on healing my cells and fixing my cell membrane, I have this super sniffer now. If I open a box, I can tell. I walk into a restaurant, I'm like, oh my gosh, the fryer oil needs cleaned. It just smells bad. And so stop eating the fried foods. Stop eating anything think avocado, coconut, and olive oil. Those are my three very favorite. And when you use oil to cook, if it starts to smoke, throw it away. That's now rancid. Or I like butter or ghee, grass-fed butter or ghee. But if it starts to smoke, it's called the smoking point. You need to throw it away and start over because now it's gone rancid. Then I would say electrolytes are super important. A lot of people are stressed and they go through electrolytes faster than they think they do. So making sure that sodium, potassium, minerals, trace minerals, things like magnesium, calcium, those are all electrolytes that are involved in the mechanism of the heart and how in the electrical current of the heart. Magnesium, and as soon as someone comes in an irregular rhythm, when their heart is quivering, we give them magnesium. And a lot of times we give them calcium. And sometimes just that alone, there's this one irregular rhythm called torsades de Pont, and it's like literally a magnesium deficiency. You give them magnesium and sometimes and that's a fatal rhythm. So, and sometimes it's caused by too much alcohol consumption of that, or even like the ketogenic diet. I love it, but it really, if you diurese, because it lets like you flush out a lot of water because you go to the bathroom often, you need to replace that. You're losing that as you go to the bathroom. So replace it. This I'm drinking is what I do in the morning. I actually had two this morning because I was feeling a little under energy, low energy. So it's my filtered water, and I put a half of a lemon, juice the half of a lemon, and then put the rind in there. And then it's red Himalayan pink salt. And that's what I do to help replace the electrolytes and stuff as I do the keto diet.
Interjection real quick is that lemons are higher in vitamin C, which the adrenals also need in conjunction with that salt there to help kickstart your adrenals in the morning.
Yeah, that's why I do it. It's my homemade adrenal cocktail. I tell people to do that all the time. There's a company that has this like scoopable thing that you can add to water. And I said, well, it's called adrenal cocktail. And I'm like, but you can make your own. This is what I do. So
I actually have a bottle of the adrenal cocktail. I believe it's Jigsaw Health is who makes the product. I got it in the capsule form.
Yeah.
So you mentioned excessive alcohol use. Some other things that can exacerbate AFib would be a family history, obviously, being overweight, long-standing uncontrolled blood pressure, having a family history of heart conditions.
Sleep apnea, you mentioned that's a big one. People don't realize
Diabetes,
the association, but there's a really big one.
Asthma, hyperthyroidism, Graves' disease, which is the autoimmune condition of your Some other ones too is if you think of the average person that's probably in their mid 50s or 60s, everybody has some degree of inflammation. Low vitamin D, which there's so many people that have low vitamin D these
Oh
days.
my gosh, you have no idea. Every time I draw labs, oh my gosh, look at your look at your vitamin D.
Yeah.
Woof.
And low vitamin D is going to inhibit, or it's going to lead to having poor nitric oxide production, which we need for the heart too. It's the
Mhm.
vasodilation of our blood vessels.
Yep. Low blood
Poor sleep.
pressure. Yep.
How many people have poor sleep and they don't prioritize good, healthy sleep?
Hmm.
And that couples into with that sleep apnea. We have mouth breathing, people not getting good, adequate, deep levels of sleep because of mouth breathing, EMF. So, if you have too many electromagnetic frequency in the house, Wi-Fi, you can turn this stuff off. If you have dirty electricity outlets in your home, if you live by power lines that are in your neighborhood,
Hmm.
environmental toxins like Tide laundry detergents, if you use that and you're sleeping in, that's a chemical toxin, or fabric softeners on your clothes, you sweat, you absorb it. Poor mental health, stress, fear, anxiety. We did a podcast last week on mindset. So if you have,
AFib and anxiety, think about the electrical current in the heart. It's going round and round. Think about anxiety. Round and round, those thoughts go.
yeah,
There is always everybody I talked to when I worked in the cath lab. I would walk into their room and I would start taking their history, and they're coming in for AFib ablation or whatever. And I would get their history and anxiety, or just hearing them talk and they're, and I'm like, oh boy, yeah, we need to work on that. Yeah.
uh, endothelial dysfunction, which is a topic we haven't yet ever discussed, which is really important. You think of men in their 50s, even 40s now, even younger, I guess today with all the toxins out there, having erectile dysfunction. That to me is a sign of hypertension on the rise, or there's a big root cause of poor blood flow and
Or
blood
inflammation. Heart
pressure.
disease is really inflammation. It's an inflammation
Absolutely.
of and the blood vessels in a man's penis are so tiny. So if you have trouble having an erection, that's because there's a poor blood flow to that area. And if that's going on, and the vessels that feed the heart muscle are not much bigger. So
Right.
if you're having trouble there, chances are you may be having trouble in your heart that you're not aware of yet.
Right.
Be mental. That is part of it. Sometimes it is
Could
just an
be.
emotional, mental thing,
Yeah.
stress of the event or whatever, depending on the circumstances. So it's not always that, but a lot of times, if say it's you're with your partner, you love her, him, her, if you're a man or a woman, depending on the relationship, you're comfortable around them. This is a new thing showing up, and you're not stressed about the event itself, then that's a check engine light for sure.
Some magnesium forms that are really good for the heart is orotate, taurate,
Orotate,
malate.
right,
Those
my
are
light.
three really good ones. To
Yeah.
help with calming down your nervous system, I love magnesium L-threonate because that's the
Yeah.
form that can go across the blood-brain barrier and have a
Yeah.
profound positive impact on just calming you down. Really good to take at night too to help you with relax and rest and getting into a better deep sleep
Yeah.
and just calming you down. Because if
Yeah.
most people probably go to bed staring at screens, watching TV, you know what I mean? Having lights on all the time. That's artificial at that. So it's harder
Yeah.
for our body to shut down.
It
And this is
stimulates the pineal gland, which is part of the area of the brain that helps us get into the good circadian rhythm that tells us to make melatonin so that we sleep better. That's why taking melatonin as a supplement is a thing, because our body makes it anyway. And
Mhm.
it's a part of what our pineal gland will release, or to create the production of. And so if we're staring at a screen and we think that it's still 8 a.m., then that's not going to help us get to sleep. That's going to really hinder that. So sleep is really important too.
100%. And there's another great marker that I know you and I both love on lab testing that we can measure for inflammation. And it's high sensitivity C-reactive protein,
Yeah.
or HSCRP. And the higher that number, the higher the risk an individual for a cardiovascular outcome, whether that is heart attack, stroke, or CVD, or AFib. It
Yeah.
doesn't tell us where the inflammation is, but it gives us a clue into looking for sources of inflammation that we want
Yeah.
to do what we can to get that number down.
Yeah. So it's a very sensitive marker for inflammation. And the reason some labs changed it to cardiac CRP is because they realized about 10 or 15 years ago now, it was when I was working in the ICU, they started making the correlation between inflammation, heart disease as an inflammatory process. And so they were starting to see people that would come in with a heart attack and their CRP was through the roof. And they're like, oh my gosh. But so is diabetes. So It
Mhm.
really, so I use it because it's a very sensitive number and it's a very good number for just general inflammation. So it doesn't mean that if you have, that's your isolated HSCRP is elevated, that you're going to have a heart attack. Because some of my younger patients are like, oh my gosh. And I'm like, no, it just means you're inflamed. Why are you inflamed? It'll go up when you're acutely ill. If you have the flu, it'll go up because you're inflamed. That's part of what's going on in your body. So yeah, it's a good number. It's a good general inflammation number.
I think we can sum it up by saying poor nutrition and chemical toxins. If doctors were taught that in medical school, I'm sure medical school would be a breeze because it can all boil down to those two things, honestly.
All the time. Yeah, all the time. It's always what's going on in the body that's creating inflammation, and where's the inflammation, and how are we
Mhm.
getting exposed to the things that are creating the issues in our body, the environmental toxins, infections that we don't know about, and then the poor diet, and also not just poor diet, but diet that does affect the gut, the permeability of the intestinal lining, so that then we end up with food proteins in our bloodstream and food sensitivities and the cascade of inflammation that causes all kinds of issues in all kinds of the body. And really like the inflammation that's in the cell. Like we talk about it all the time. It's like I'll beat the drum as long as I need to, because really if the cells don't work, then everything doesn't work. And that's where the inflammation really starts, is in our cells.
100%. And overall, we can trace it upstream far enough to find pesticides or phthalates, parabens, plastics, pharmaceuticals that are just in our water system, let alone in Glade plugins, fabric softeners, laundry detergents, dish detergents. Don't forget about the heavy metals you mentioned. You have mercury, lead, arsenic, cadmium, aluminum that are so ubiquitous in our environment today. The dangerous microbes, I mentioned H. pylori, parasites. We talked about parasites on a previous podcast, so go check that out. Bacteria, viruses, Teflon cookware. So imagine people using that in their kitchen because it's easier to clean. But just want to bring this around full circle. So the British Medical Journal talked about safety risk for consumption of fish oils. We agree that sourcing is highly important. There are some benefits to it, but if you're still concerned about should I throw out my fish oil supplements, what did you say? You can take the algae, is that correct?
Yes, there's two companies that I trust. Sun Warrior is the one brand, and Metagenics. They both have good algae supplements.
What companies would you recommend or suggest for people to take for fish oil?
Yeah, the company, it's new. The one that I referenced that has 4 products and 1 test is called Evidence-Based Supplements. That's what they do. They test everything. They make sure that it's pure and sustainably and ethically resourced. That's what they do. I really love that company a lot, the more I'm learning about it. The other company that I trust is Body Bio. Their products are really awesome and they test everything. So I really appreciate them. And those would be the two that I would start with. There's a couple other companies I used to use that I don't choose to use anymore. So, because I'm not sure.
Yeah, I really appreciate the recommendations there because I know people are always wanting to know what do you take and where can I go get what you recommend. You can check out foundationsandwellness.com because we do have our store coming up very soon on there where you can
Yeah,
purchase these products.
yeah, for sure. But this has been a great conversation and I appreciate the opportunity to talk about this. So,
Absolutely. But thank you so much for being here this afternoon. And I really appreciate the time. And any
yeah.
final words of wisdom from you on anything?
Hey, I would just encourage you to, if you like this, follow us on social media. We're on all the channels and check out our website. Great things are there. Great things are coming. We've got lots of different things to offer, from programs and memberships, a new store we're building. We have blog articles every week. I sign up for our newsletter if you'd like to do that. There's a freebie handout that you can get when you come to the website. So foundationsandwellness.com is where you'll find us.
Well, thank you all so much. Have a blessed weekend. And
All
Teresa,
right.
we'll see you next week.
See you next week.